Evidence-based approach to pediatric nurse practitioner development. Introduction. The healthcare sector has numerous professions, and among them is nursing with various areas of specialties. Nurses are experts in the caregiving of unspecific diseases in any environment. These different areas of specialists help them work in all settings. Nurses represent the largest group in the health field in the United States and provide initial contact with patients in many cases, putting them in a position where they can significantly help reduce oral health issues. This paper will focus on the pediatric nurse practitioners who deal with infants to adolescents. Generally, their role is to treat, observe, and diagnose young patients. The paper will discuss the changes required to improve operations in this field. Evidence-based projects. Evidence-based projects are vital in the nursing profession. Following Lott et al., the emphasis on evidence-based practice, EBP, in nursing to improve patient outcomes continues to grow, but inconsistencies remain in its implementation across organizations. The evidence-based projects have been beneficial to healthcare practitioners. They take risks and are more knowledgeable in diagnosis. Additionally, they are well prepared for challenges and can overcome them easily. They advance patient care and treatment. Evidence-based practices offer efficient diagnosis and improve medical protocols. Engaging more clinical nurses in EBP implementation as part of a culture of inquiry is essential to fostering high-quality, safe, and cost-effective patient care. Nurses should consider the implementation of evidence-based projects always. Conceptual model. Stetler's evidence-based practice model uses 6 phases: preparation, validation of the evidence, comparative evaluation, decision-making, refinements to provide implementation and application, and assessment of outcomes. It applies in the EBP in concluding research. In addition, according to Indra, it has been updated and refined to fit in the evidence-based project paradigm and summarizes the criteria to forward an issue in nursing. The model is practical and has been applied in various health sectors. The model considers both internal and external factors. Generally, conceptual models help reduce difficulties in implementation. Nurses are rooted in research and shreds of evidence in patient care and diagnosis. Nurses should then consider identifying relevant models they can apply. Area of interest. Disruptive behavioral problems such as temper tantrums, attention deficit hyperactivity disorder, and oppositional, defiant, or conduct disorders are the most typical behavioral problems in preschool and school-age children. Children's care and attention determine their outcomes in the future. Parents, caregivers, and pediatricians should be keen on their development and behavioral stages. Childhood behavior and emotional problems with their related disorders have significant negative impacts on the individual, the family, and society. Developmental behavioral pediatrics plays many critical roles in academic medicine and community advocacy. It is essential in advancing the growth and care of young patients. Therefore, pediatricians should encourage the connection between children and their parents or guardians. Concerns and recommendations for change. Children's development has several issues. For instance, kids can develop disorders such as unusual sleeping hours and poor nutrition. Development behavioral change should be considered with close attention. A child can develop different disorders such as temper tantrums, fine motor delays, cognitive delays, often crying, emotional delays, and aggression. It should be of critical concern to the parents, caregivers, guardians, and the community. Development behavioral change should be of proficiency to the pediatricians. Society must be sensitized to the changes that might occur. Emotional and behavioral problems among children have been increasing in many Western as well as Eastern countries. Recommendations include that pediatricians should be trained in development behavioral change. Additionally, the parents and guardians should be close to their children. Factors influencing change. These factors affect the goals and objectives of the practitioners. External factors that can cause change are patient illness, patient cooperation, inflation and unemployment, politics, technology, environment, social interaction, patient socio-demographic variables, and physician socio-demographic factors. Patients have a great influence on the change in healthcare. Their satisfaction and treatment determine the operation of healthcare. Most, if not all, services in healthcare services deal with patients. They are the stakeholders of the hospital. Internal factors are the availability of resources, cultural values, personal values, the performance of the facility, relationships in work, leadership, and finances. Both of these factors can either lead to change or not. They can be a hindrance in implementing changes in healthcare. NONPF competencies. In the development of the nurse practitioner population-focused competencies, a task force had extensive discussions of competencies versus content. The core competencies are a guide in carrying out the daily task. The core competencies that aid in EBP are quality competencies and leadership. Quality competencies in the provision of quality service are based on previous research. It uses the best available evidence to continuously improve the quality of clinical practice. Leadership is always the key to any success of an organization. According to Thomas et al., a leader should communicate practice knowledge effectively, both orally and in writing. The leaders ensure that evidence-based practices are implemented. Other core competencies are practice inquiry competencies, scientific foundation competencies, technology and information literacy competencies, and policy competencies. Conclusion. Advancement in medical protocols and diagnosis is essential, and evidence-based practice should be used. Consideration of how the models work facilitates EBP projects and provides guidelines for evidence critique. It also guides the process of implementing practice changes. Additionally, the core competencies must be implemented. The policies set in the NONPF are a guide, thus, all nurses are directed to provide better services. They learn through experience and pieces of evidence. Diagnosis changes with time, hence being updated is vital. The nurses should understand the need for change, and they should be aware of where to apply it. Moreover, the strategies and recommendations must be clear and practical.